Can you come on this way?
One sec. All right, we get started. There we go. So a lot of people are pretty worried about what's going on in the world right now, understandably. And a lot of people have been reaching out to say, what do I think about it? How can they optimize their immune system? Why do certain people, like, let's say even myself, get sick and maybe get it very badly? And what can people do themselves to prevent the worst case scenario from happening? And there are actually quite a few things that can be done. I've been looking through all the different research that has come out actually since SARS-1 15 years ago. There's been a lot of research, and a lot of it can be applied to the new one with some modifications, and we'll go through all the different parts. So first, a disclaimer, just to make sure you can see it properly. So all of this is just educational purpose and is not meant to diagnose or treat anything. I'm not a medical doctor, I'm a functional medicine practitioner. So if you have any symptoms and you're not feeling well, do go to your medical doctor or reach out to them. Also, all the information I present today is the research that I have been gathering at the best of my knowledge. Obviously, there's so much new research coming out every day that it is, there might be something new coming out today or tomorrow, but this is the best that I could find, the most relevant until 2 days ago, until I put this presentation together. So the content what we're looking at today is the different stages and potential problems from a functional immunology viewpoint. So where in the different sections of the disease process can things go wrong, and what can we do about it? Also a little bit about genetics and epigenetics, how to support our immune system and the different functions very targetedly, and what tests might be good to support oneself in this whole process. Some of the questions that we'll go through and that I just mentioned is that the ones that I've been asked from my patients, from friends, and also been asking myself over the last 2 months is, why do some people catch it and why some don't, despite exposure? So I've been seeing a lot of my patients that actually, even though they were exposed, their children had it, or other friends that they were in close contact with, and they still didn't catch it or didn't notice any symptoms. And why do some other people develop mild and almost no symptoms at all, while others have quite severe symptoms, even if they're maybe in their mid-20s, mid-30s, mid-40s, that it's not really the target group of severe symptoms? Why do they catch them? What can we do about them? And why do then some develop those very scary, life-threatening symptoms? What's the underlying silver line there? And then obviously also all these new scary causes of death, of mortality that are popping up on the news in the last weeks, including the kids' disease now, Kawasaki, where they get this rash all over the body. And they all seem so unrelated, but actually, what is that silver line that connects all of them? So we'll dive into all of that. And then also last thing is that why do some people, let's say middle-aged or any age, they get symptoms, they feel better, and then it keeps coming back? What's at play there, and what can one do individually to support that? Okay, so we'll go into our immune system. A lot of it you might remember from biology class, and then we'll dive into a little more. So first of all, if the virus wants to enter our body, it has to actually find somewhere to get in. And that usually is our mucosal layers inside our lungs, inside our eyes, inside our urinary tract, for example. Once it hits our body, the immune system starts to create a response, an inflammation, and it pours out lots of different chemicals to try and fight it off. It has a fever and tries and kills it. Now, either we recover and maybe we're immune, or something else happens where we all of a sudden, a different part of the immune system comes to play, and we maybe develop this very dangerous and potentially lethal cytokine storm. We'll get to that in detail later. And the virus persists. So we'll go through the different parts. The first of it, the immune barrier. So that's the first line of defense. And that makes whether some people actually, even though they're exposed to it, develop symptoms or maybe don't develop symptoms at all, even though they're maybe not that healthy and they may be in the risk age group, but they still don't even catch it, even though they're exposed. And that could be that their first line of defense, that first immune barrier is just so strong that it doesn't actually allow the virus to enter into the body and into the bloodstream to cause havoc. So what are the different parts there? And like I previously mentioned quickly, there's this mucosal lining that is in our lungs, for example, in our gut, in our eyes, all these parts that over the last 2 months, the news were saying we want to try and cover them up. We don't want to touch our hands into our eyes or into our mouth, because that's how we might be exposed to the virus, and it could get through the mucosal lining. It's like a lining with a little bit of mucus and then enter. And then the next part, in that mucosal lining, we have tight junctions in that epithelial layer. And either they are strong and they have some antiviral properties, or they're weakened. And we'll get through why they might be weakened in the next place. And they're natural killer cells and macrophages that are just part of our immune system that should be in that lining and not allow the virus to even enter into our body. And then the next part that we'll get into are called AC2 receptors. You might have heard of them in the news, because they have to do with our blood pressure regulation. But they also actually have been shown to be the main point of entrance for the virus, for the coronavirus. So we'll get into all these different parts in a moment. Yeah, there we go. So what are the different factors that affect our mucosal lining, whether it is strong or whether it is weakened? And most of them are actually just normal, general, healthy living basics. So if there's something called SIGA, which is a secretory immune system in that lining, and that needs to be strong to fight off the virus to not even enter the body. Now, if we do things like if we're very stressed, it's been shown that decreases that SIGA. It also has been shown that if we drink excessive alcohol, I'm not talking about 1 glass of red wine a night, but more of it, if we drink more alcohol, that also degrades that SIGA. Or if you have chronic co-infections, what does that mean? So a lot of you might have heard of our gut microbiome and candida and things like that. So if we don't have the right balance of bacteria, yeast, parasites in our gut, and that happens over a long time, that eventually that part of the immune system gets fatigued and says, okay, well, we have these infections anyways, I'm tired now. So then this first line of defense doesn't work properly. The next parts that are important there, and you probably heard of them on the news, vitamin D, A, E, and zinc. They are all very important to get that mucosal lining to be strong. Now, a lot of us are vitamin D deficient, most of us. So when I test my patients, unless they're taking high doses of vitamin D, a lot of people are deficient, even in summer, because they're working inside, they're hiding from the sun because they heard that sunshine is bad for their skin or for cancers. So a lot of people are vitamin D deficient. And then also vitamin A and E and zinc. And those are quite common deficiencies as well, especially in people that are trying to be health conscious and maybe eat less meat, eat less dairy, because A and zinc are mainly really present in an absorbable form in animal products like butter, organ meats, fish. And they are all important to keep that mucosal lining strong. Another factor that keeps that mucosal lining strong are omega-3s. So you might be thinking, okay, all of that I've heard about, so this is all very basic. And that's exactly why a lot of people that just follow the basic rules and they don't have a very stressful life, which is one of the big problems, they actually are fine. So I've seen it a lot here with patients of mine, 55 plus, they may be able to work a little bit less at that stage in life. They're not that stressed. They know the basics of healthy living. They exercise, but they don't over-exercise. They take their vitamin D. They eat natural, healthy food, and they don't actually catch it. So that first line of defense has really got to do a lot with that. But where it often goes wrong with, let's say, people in their mid-30s, mid-40s, they may be drinking, maybe they're very stressed because they're working in a very stressful job, they're trying to get their career going, maybe they're partying and not sleeping enough. So that's all part of that first line of defense. Why do people catch it? And then the next thing is that these tight junctions in our mucosal lining, whether they are tight. So the mucosal lining, all the factors, they do play a role there too, but specifically there's some other things that keep those junctions tight so the virus can't even enter into the body. And one is, again, is stress. So it's a huge factor. If our brain sends stress signals into our mucosal linings, then the tight junctions open up. Also, if we're not getting enough fiber, those tight junctions don't get food to stay strong. And that's, for example, we need that fiber to make short-chain fatty acids and butyrate, because they feed our gut lining and our lung lining, our mucosal lines. All these tight junctions, they need fiber from vegetables mainly to be strong. Then the next thing that might open up those tight junctions are food intolerances. So if people have a food intolerance and they keep eating certain foods without knowing that they may be intolerant to, let's say, something healthy like almonds, their immune system gets triggered every time they eat it, and those junctions, there's a slight inflammation and they open up and they get leaky. So that is another trigger that could cause problems there. And again, same as with the mucosal lining, if there are co-infections such as SIBO or Candida or gut microbiome imbalances, then that can also, they can damage the tight junctions and make them open up wider. Then the next thing that we talked about is we're still in that first line of defense, still in that first lining, whether the virus can even enter the body. There are certain cells called natural killer cells and macrophages, and they need to be strong in order to just fight off the virus and say, no, you are not what we want inside our body, you're not allowed in, and they just fight it off. Now, there's certain problems in our daily life that can lower them. And you'll see throughout the whole talk, things keep coming back in circles. So it'll be the same thing over and over, and it'll all start making a lot of sense. So if someone is constantly stressed for a long time and they're really burned out, then their body can't actually mount a proper immune response, because the natural killer cells get down-regulated, but also the macrophages, also those immune cells, they both get down-regulated. So now we don't only have a not strong mucosal lining and junctions that are open and let viruses in, our first line of defense also is weak. So there's not much to defend us. The next thing so our natural killer cells, they actually rely on certain things called toll-like receptors to recognize the virus and say to the immune system, this is not right, we need to do something against it. And they can be influenced by air pollution. So someone that lives in a polluted city, let's say New York City, London, there's a lot of, the death rate is going higher because the virus actually gets into our body more easily, and the first line of defense doesn't work as well. Again, stress also affects the toll-like receptors, certain drugs, recreational drugs and medications, but also, again, certain nutrients. So if someone is deficient in vitamin B12, then those receptors are not working as well. Again, same thing, vitamin D and zinc and A, very important for the receptors to work, but also iron and copper. And a lot of people are deficient in a lot of those, just simply by not eating a whole foods diet. And then another thing that I know some of you that are listening today, you're working with that a lot, so that's great. Something called T-Chuck proteins, and they can be triggered and strengthened by saunas or cold therapy. And if they're being strengthened, they also make those receptors recognize and recruit the immune system better. And then on another thing, again, chronic infections, like urinary tract infections or other sorts of recurrent infections, they will also downregulate those first line of receptors so the immune system doesn't even turn on properly. Now, and for the macrophages, same same thing again, stress and zinc deficiency. They just don't work as well. And then for all of them, there are also genetic predispositions, but we'll get into that a little bit more in detail a little later. The last part of that first line, that first barrier puzzle, that is a little complicated. I won't go into much detail, but if you have more detailed questions, you can always message them to me, and I'll try and address them after, or at the end of the talk. So we have these receptors that have to open up to allow the virus to actually enter into our body and into our cells. And they are in that epithelial lining, in that lining that first connects our body to the outer world where the virus comes in. Now they are regulated by genes, but also regulated by blood pressure medications and by other factors. So they get upregulated if people are younger, which kind of a lot of people say, wait, but that doesn't make sense. Don't young people have less problems with the virus? But that's not actually true. A lot of young people catch it, but they just don't have the severe issues. So we're still talking about that first line, whether people actually allow the virus to enter. So a lot of young people let that virus in, but then they can fight it off better later. So older people, or the older we get, often that those receptors are actually downregulated, also contributing to the fact why some elderly people or people that are just starting to go towards older age and they are healthy, they're taking their vitamins, they're not stressed, they don't have any infections in their body. Those receptors are also not as open, so they don't even get that much of a viral load. So that works in their favor in the beginning. Then there's also other things that downregulated, and that might sound counterintuitive as well. Again, smoking downregulates those receptors. So again, smokers might be less susceptible to getting it through the ACE2 receptors, but if it comes into the body, the lungs are obviously very weakened through the smoking. They'll have more issues with the severe cases. And then people have talked about the chloroquine, and that might be a thing that can lower those ACE2 receptors and then not allow as many people, as many virus to actually enter the body. All of that gets normalized by vitamin D levels. And also one other thing, and that is called S protein. And the S protein needs to actually be primed to allow the virus to dock onto the ACE2 receptor and enter into our body and into our cells. Now, there are other factors that make that S protein prime and allow the virus to enter. And that's, you might have heard of, male might be a little bit more prone to it, and that can have a role here because there's a receptor called, or an enzyme called TMPRSS2 that gets upregulated with the male hormones. Women have it as well, but male more, like androgens, testosterone, but also certain stress hormones. And new research also shows that maybe if someone has a lot of estrogen dominance, they can also upregulate that TMPRSS2, which then allows the virus to dock onto the receptors and enter more. So that all plays a role. So to actually catching the virus and allowing it into our body, into our cells. But then the actual problem is once it is in the body. Now, how does our immune system respond to it? Does it fight it off? Does it mount an appropriate immune response right away? Can it fight it off, kill it off when the virus enters into the cell? Where is it? Can it, the cells, can they be killed and be disposed? And then the body gets an immunity and recovers, and then that's it, then it's done, we're recovered? Or is there a problem in that process that then mounts that potentially lethal called cytokine storm? And we'll go into what affects the two different pathways in more detail, and what is that actually, that cytokine storm that you might have heard on the news, that is the silver lining between all the lethal conditions associated with COVID. So here, just from the news, 7th of April, why some COVID-19 patients crashed, the body's immune system might be to blame. And then down here, the cause is the body's own immune system overreacting to the virus. The problem, known broadly as cytokine storm, can happen when the immune system triggers a runaway response that causes more damage to its own cells than to the invader it is trying to fight. Or another one from a journal, and that's just about the inflammation, not about COVID, and that's uncontrolled inflammation and cytokines causing the acute lung injury, which is one of the lethal conditions in COVID. And again, here, uncontrolled inflammation in acute lung injury. Down here, if you go there, that's also, again, where's my slide? You can see the number of cytokines such as TNF-alpha, IL-6, IL-17, IL-1 beta, all of those, they increase and the cytokines go up, and that can be at the core issue of that acute lung infection. We'll go into all of that a little more in detail, so don't worry. I'm just showing you that that's all over the research papers, all over the news, if you just look for it. So again, here the Lancet, that was April 20th of 2020, saying endothelial cell infection and endothelitis in COVID-19. What does that mean? Again, the endothelial cells that we talked about before, they're not just in our lungs, in our gut, but they're actually all everywhere around organs, around our blood vessels, around our heart. And if they get infected and inflamed, that might be one of the leading causes of death or severe conditions. And I'll just show you a few more slides so you can see that it's actually all connected to that inflammation. So again, here the Lancet, April 23, 2020, myocarditis, so that is an inflammation of the heart. Again, myocarditis in patients with COVID-19, accumulation of inflammatory cells and inflammatory cell death. So that all has been proven in the last month to be one of the underlying things. So if I go back to an older study from 2014, it shows that viral myocarditis, so a heart inflammation that is caused by a virus, is involved, has this NLRP3 inflammasome that you might have seen before, has that involvement. Then another thing here, again, when was that? So I took that screenshot a couple of days ago. So it was this week, just on the news, COVID-19 may be tied to rare syndrome in children. And that, again, it's inflammatory syndrome, and it's linked to a multi-system inflammatory disease. And again, they see markers of severe inflammation. And down here, you can see we're learning more about COVID-19 every day. It seems like one of the hallmarks of the disease is inflammation, including a cytokine storm or an aggressive immune system reaction that can damage the body's organ. So there's uncontrolled inflammation. And here again, it says the immune system is important, but if it's not well controlled, then at the later stage, it will cause collateral damage to tissues, especially lung tissue. Such a sustained excessive cytokine release or storm is the cause of death in a variety of infectious diseases, including the flu, COVID-19, Ebola, and sepsis. So I'm just showing you these things to show it's actually all out there if people are looking, but obviously that's sometimes hard to do. So I've been doing all the digging, all the research, and here again, so Kawasaki disease, which is where people on the news say, but what has that to do with the rest? It's now all of a sudden children are infected, but actually the same thing, Kawasaki disease here from last year, they found that that has to do with the NLRP3 inflammasome and something called pyroptosis. We'll go into those words, so just remember those: cytokine storm, NLRP3 inflammasome, and pyroptosis. Those are the main ones that we'll go into detail because they are the silver lining of all the different things, whether it is heart inflammation that can happen with COVID, or whether it is our cell linings in our arteries, whether they're inflamed and then all of a sudden starting to lead to blood clots, or whether it's our lungs that start to have an acute pulmonary problems and we can't breathe anymore. They all have those at their core. Okay, and then here, again, discovered metabolic mechanism of cytokine storm. They see that the inflammatory response is known as cytokine storm. So again, just another paper that shows that that's at the root cause. And here again, some research is saying suppressing the body's immune system at the exact moment it's trying to fight off the deadly coronavirus could have all sorts of unintended consequences. So there might be a reason we want to try and control that cytokine storm, but obviously not. We don't want to kick it in the curb entirely, because it's important to fight off the illness. And we'll get into all of that. I'm just showing you these things for a moment. And one last thing I wanted to read before we go into what this actually all is. In the last column here, it may be that you need to wait until actually there's a sufficient immune response going on that can drive the cytokine storms, and the body's most powerful T cells, powerful immune cells known as T cells, take about a week to build up in the body. That is why some of the patients start to improve and then potentially worsen rapidly as those cells continue to proliferate. And that's when the problems often occur. So now enough of this. We'll go into what is it actually? What's the cytokine storm? What would be affected with immunosuppression, and what can we do from a functional medicine perspective without having to use heavy drugs and without relying on more research to find specific mechanisms to fight each illness. We try with functional medicine, we try and address that underlying issue, that cytokine storm. Why is the body doing that in some people, and in some other people it doesn't seem to be doing that? So again, here just quickly, and then we'll go into it. These molecules are pro-inflammatory molecules that form an entity called inflammasome, of which the most well studies is the NLRP3 inflammasome. This is a state of inflammation that, if excessive, has been shown to have a role in many other chronic health conditions, including gout, rheumatoid arthritis, autoimmune conditions, cancers. So now we start to go into that. Why do some comorbidities, what's their relationship to worst case scenarios with COVID? Then the next thing is inflammasome activation triggers blood clotting and host death through pyroptosis. Again, this is in the Cell magazine. They're all research papers, and you can click, I'll upload this after. You can click on all the links and read it if you like. And then one more paper, Science Direct, multi-organ failure induced by viral upregulation of inflammatory processes and cytokine release. So all of this just to show that there is quite a lot of research out there that all these different problems that we see actually connect at that one common denominator. Why do some people all of a sudden develop these very dangerous symptoms and potentially lethal symptoms? Okay, so here we go back to our immune system recap, a very simplified version. The virus comes in and then we fight this inflammation. That is a normal thing to fight off any kind of infection. Our body has to do it, and it releases cytokines. And you now may remember we've talked about cytokine storm. Is that a bad thing? No, we do need some cytokines, and they're different varieties. We need some cytokines to attach the virus, get rid of it. We need that fever to also dissolve the virus, the protein inside the virus. If there's a fever, it can't replicate, it can't continue properly. So we need that fever. And then after a while, if the virus is still there, then we have, like a week later, we have the T cells that come in and try and attack that virus. And now that's where it can go wrong. It's where there's there are many different types, but the ones we'll mainly talk about today is the Th1 immune response versus the Th17. We'll leave out the Th2 for today because it gets too complicated. The main two are the Th1 and the Th17. Let's go back to the side. Because the Th1 is the one that can kill off the virus. That's what we need to kill off a virus and to then get rid of it. The Th17 is the one that releases the cytokines that can cause a cytokine storm, that can release that NLRP3 inflammasome and then potentially have lethal conditions. So those are the two we'll look into detail. What is triggering either the body to turn on the Th1 or the Th17? Because that's what we can influence in our day-to-day life. Okay, so in that first part though, before we even get to the Th response, when the virus comes in, the immune system tries to fight it. It goes into some of our cells, that's just normal, and it replicates. So normally the virus injects its genetic material into our cell, and then our cell starts to produce that viral genetic material. Now there's certain things that can make that calm down and not work as well, and that we can influence again. And there's certain things, and it's the same thing again as we had before. Zinc helps to, in most cases, in most viruses, helps the body, our cell, to not allow the virus to keep going inside and reproduce more virus cells. Then fever, same thing. It just destroys the virus inside our cells and doesn't allow it to replicate. And then also something called lysine versus arginine ratio. Maybe some of you that have worked with me before that maybe have cold sores or things like that. It's the same thing. So lysine and arginine are both parts of protein found in our food, and they're both important for health, but they need to be in a good balance. Now, if we have too much arginine, it actually supports the virus to keep replicating and keep making more virus inside our body. If we have more lysine, or we are in a balance here, then that is not, the virus can't do it properly. So we want to, as a countermeasure or just as a preventative thing, we want to support our lysine. So we have both. So arginine is found, for example, in lots of healthy things like nuts and seeds, grains, buckwheat, things like that, healthy grains, not gluten. But so those are healthy foods and we need them. But we do need the lysine, and that is more often found in animal products. And that's, again, a thing that often people try and cut out animal products, but they actually need the lysine. So lysine is really high in dairy products. So for people that are not dairy intolerant, that could be a good source. But it is also quite high in fish, in meat, but also certain vegetables like cauliflower is quite high in it. Avocados are quite high in it. So maybe just look up what is high in lysine, what's high in arginine, and try and get a balance, because you want both. You don't want to cut out arginine entirely. Or you could supplement. If you're a vegetarian or vegan, you might want to supplement with lysine as a preventative measure, because you're just not getting it from the diet then. And then also how well our mitochondria function. You might have heard of our mitochondria. They're the little parts inside each of our cell that produces energy. Now, they have found that if they don't function as well because of heavy metals, because of long-term stressors, because of long-term infections, they can block our mitochondria. And they found that that is actually related to how well the virus can replicate. So if we, as a preventative measure, can strengthen our mitochondria, then once we get exposed to the virus, and if it enters our body, then we are better well equipped to not get that virus to take over as well. And simple things to fix the mitochondria here are getting rid of heavy metals, again, getting rid of co-infections like candida and gut microbiome imbalances, but also shifting more towards a ketogenic or a fat-burning diet rather than sugars, because sugars actually, first of all, feed the virus, but second of all, also damage the mitochondria if we have too much of it. We can have a little bit of carbs, that's important for us, but not eating processed foods and sugars all day long, because they actually damage our mitochondria. So all of this is just in the actual cell, whether the virus gets a chance to replicate once it's in there.